बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलाम वालेकुम वरहमतुल्लाहि वबरकातुहू। कैसे हैं दोस्तों? उम्मीद करती हूँ कि आप सब खैरियत से होंगे। मेरे चैनल पे जो नए हैं मैं उनसे रिक्वेस्ट करती हूँ कि वो मेरे चैनल को लाइक, सब्सक्राइब और शेयर करें ताकि मेरी हर आने वाली नई वीडियो आप तक आसानी से पहुँच सके। कवरेज, आज का हमारा टॉपिक चैनल है कवरेज हेल्थ एक्सपर्ट, और हमारा टॉपिक जो है वो है अंडरस्टैंडिंग हेल्थ insurance, deductible, copayments and coinsurance. Understanding health insurance can be confusing especially when it comes to the different terms and concept involved. Three important terms to understand are deductibles, copayments and coinsurance. These terms refer to the amount of money you pay out of pocket for medical expenses, and they can have a significant impact on your overall healthcare cost. Here's what you need to know about deductible, copayments and coinsurance. Deductible. A deductible is the amount of money you must pay out of pocket for medical expenses before your insurance coverage begin. For example, if you have a $1,000 deductible, you will need to pay 1,000 for medical expenses before your insurance coverage kicks in. And this means that if you have a medical bills 500, you will need to pay the entry 500 out of pockets. However, if you have a medical bill for 1500, you will only need to pay 1000 out of pocket, and our insurance and your insurance will cover the remaining 500. Deductible can vary depending on your insurance plan. Some plans may have a high deductible while many have a low deductible. Plans with high deductibles typically have lower premium, while plans with lower deductible typically have higher premium. It's important to note that some medical expenses may not be subject to the deductible. For example, prevention care services such as annual check-up and vaccination are often covered by insurance without the need to meet the deductible. Additionally, some plans may have separate deductible for certain types of medical services such as prescriptions, drugs or hospital stays. Copayments or copays is a fixed amount of money you pay for a medical service or prescriptions drug. For example, if you have a 20 copays for a doctor visit, you will need to pay 20 each time you visit the doctor. Copays can vary depending on the type of medical service or prescription drugs as well as your insurance plan. Copays are typically used for routine medical series such as doctor visit, specialized visit and prescription drugs. They are designed to encourage people to seek medical care when needed, as they provide the predictable cost for medicine survives. Coinsurance is the percentage of medical cost you are responsible for after you have met your deductible. For example, if you have a coinsurance of 20%, you will be responsible for paying 20% of the cost of a medical service, while your insurance will cover the remaining 80%. मैं उम्मीद करती हूँ कि आपको मेरा चैनल बहुत ही पसंद आया होगा। अगर आपको पसंद आए तो आप मेरे चैनल को लाइक करना ना भूलिएगा, और जो मेरे चैनल पे नए हैं मैं उनसे दोबारा रिक्वेस्ट करती हूँ कि मेरे चैनल को लाइक, सब्सक्राइब और शेयर करना ना भूलिएगा, ताकि मेरी हर आने वाली नई वीडियो आप तक आसानी से पहुँच सके। हमारी अगली मुलाकात अगले चैनल में होगी, नई वीडियो में होगी। अल्लाह हाफिज़, बाय बाय।